I mean, with the youth cancer service, then we also want to have everyone go through a psychosocial MDT, and that's, you know, so the tumour MDTs really treat the lump or the leukemia, or as it were, and then you've got the sort of psychosocial side of things, where it's, you know, you have in the same room, you've got the, you know, the occupational therapists, the physiotherapists, you've got the social workers, you've got the clinical nurse coordinators, you've got the psych liaison, you've got, you know, I suppose us as oncologists, we sort of form a little part of it as well. But it's really about presenting the patient as a whole, and getting their, you know, their background, finding out, you know, what's going to be, you know, a potential barrier to them sort of progressing through, you know, like financial, etc. You know, distance, you know, making sure we can, you know, get accommodation for them if they need it, and things like that. And then if they need, you know, if they need physio, or, you know, the occupational therapists, you know, it's more about getting all of that sort of side of things done, and really about assessing the patient, and sort of working out who are the best people suited. You know, it might be, you know, music therapy to help them, you know, get through, you know, their treatment, or it might be, you know, having, you know, the leisure therapist visiting them while they're an inpatient to sort of, you know, so they're not bored, you know, and setting up some things that makes sort of, I suppose, the hospital stay a more tolerable one. I mean, I don't think it's ever going to be a, you know, a fantastic, oh, let's go to hospital, but it's really about making it something that, you know, you can put up with if you have to.